Thank you to everyone who's logged on today. The Real Food Blends and Nutricia team is very excited to co-sponsor today's event with the Oley Foundation. And if we move on to our next slide. Now, for anyone who's new to learning about Real Food Blends was founded by a family who has a tube-fed child named AJ. And AJ had just struggled with tolerating conventional formulas. And so that's when mom and dad decided, let's take matters into our own hands. And they started blending on their own at home. Well, AJ did so well with blenderized tube feeding that it sparked the creation of Real Food Blends. And today we're really happy to offer 8 different 100% real food meals and a snack, all with no synthetic ingredients and ready to feed for children and adults with feeding tubes. And we very recently added 2 new calorically dense, high protein meal options known as Real Food Blends Select. And if we move, all right, thanks, Stacy. And so now we're very excited to be part of the Nutricia family of brands with an overall mission to bring health through food to as many people as possible. So without further delay, it's my pleasure to introduce your main speaker for today's event, Stacy McSwine. As Coverage and Payer Account Manager, Stacy provides valuable insight into the development of long-term vision and strategy to really optimize reimbursement for Nutricia products. Her responsibilities include providing expert guidance on healthcare reimbursement, identifying key opportunities with payers, and overseeing our Nutricia Navigator program, which you're going to learn all about today. Stacy's career is marked by a dedication to deploying value-based contract landscapes and leading large-scale projects aimed at implementing payment models that align with improved patient outcomes. And Stacy's expertise and leadership are instrumental in navigating the very complex landscape of healthcare reimbursement. And so without any further delay, Stacy, the mic is all yours.
Oh, Stacy, you're on mute.
Perfect. Are we able to hear me?
You're all set. Yes, we got you.
Awesome. Thank you so much, Tracy, and thank you, Victoria, for that wonderful introduction. I am so excited to have the opportunity today to meet with everyone on the call, and I wanted to just thank you all for taking time out of your morning to join us as I spend time discussing product coverage and access assistance support of Real Food Blends through the Nutricia Navigator. So there are no disclosures. And during this session, you will gain insight into the benefits of the Nutricia Navigator program. You will have a greater understanding of how the Nutricia Navigator directs the complex environment among patients, their healthcare teams, as well as health insurance companies, in order to guide families as well as their caregivers in exploring a variety of coverage options that are available to them. As well as during this webinar, you will receive tips to share with your healthcare professionals, as well as your families, to help you journey through this program successfully. Now let's get started with an overview of the Nutricia Navigator. So what is the Navigator? Our Nutricia Navigator is a complementary patient-centric assistance program that's really designed to support our patients in various aspects of their healthcare journey. Now, this program aims to assist patients with navigating what we all know to be a complex insurance environment by providing personalized support, as well as education, resources, and identifying available assistance programs to patients who are facing unique challenges. Now, by offering free personalized one-on-one support, we feel like that is truly the hallmark of the Navigator program. Patients who are referred to our program are assigned a dedicated support person. We call these our Navigator case managers, who serve as the main point of contact throughout your enrollment in the program. The case managers regularly checks in with you, the patient, your care team, as well as your healthcare providers to provide updates as well as to provide guidance and to answer any questions that you may have. These check-ins occur in a variety of ways, including email, phone, fax sometimes with the provider's office. It's really depending on preference and accessibility, but just to let you know, we utilize every option to keep everyone informed. All support of the program is comprehensive in nature and truly designed to explore available insurance and fulfillment options for you, the patient. The Navigator team creates an environment that really provides faster access to Nutricia products, including real food blends. This is achieved by deploying our case managers to serve as your liaison, designed to ensure effective and efficient communication between yourself, your healthcare team, as well as the supplier who will be sending you real food blends. Ultimately, the Nutrition Navigator program can help to ensure that you receive your real food blends meals that you need in a timely manner, greatly reducing the risk of any treatment delays. Now, let's spend a little time talking more about the personalized support that the Nutrition Navigator program offers. We all know that navigating health insurance can indeed be somewhat of a maze, right? Especially when it comes to specialized services. The Navigator team is here to help explore coverage details, medical necessity policies, in and out of network status, as well as help you to navigate the appeals process when appropriate. When you are faced with insufficient insurance coverage, our Nutrition Navigator can help to explore alternate options, such as screening for to in checking eligibility to see if you might qualify for any other assistance programs where applicable. The Nutrition Navigator also maintains a thorough record of all communication with insurance companies, with your healthcare team, as well as your suppliers. This can be invaluable if you decide that you want to dispute a coverage decision or if you would like to pursue an appeal. They can also help with minimizing administrative hurdles that your care team may face, such as identifying and communicating with your provider's office prior authorization requirements, and also providing guidance to that team on how to complete those forms, as well as following up with your insurance company to ensure all reviews are in process. The Navigator serves as a crucial lifeline to patients who are prescribed real food blends meals. It also serves as a great support option for patients who may have recently had a change in their health insurance or in their coverage policies, helping you to explore alternate options or any assistance programs that might be available for you and your family. By explicitly understanding insurance coverage, advocating for your needs and also exploring all available resources, the Nutrition Navigator team can manage the complexities of the healthcare system to ensure you receive the access to the Real Food Blends meals to support your ideal outcomes.
Now we have a poll question for everybody. So on average, how often have you contacted your health insurance company to confirm if a product or service was covered? So we have A, weekly, B, monthly, C, I'm new to learning about how my health insurance benefits works, but I'm excited to learn more. So please submit your answers and I will share the results. Go ahead and click on your screen for those that are able. All right, we're up to 80% so far with I'm new to learning about how my health insurance benefits work, but I'm excited to learn more. Oh, it's going down a little. 67. Okay, we still get some more coming in. I'll give it another minute. Stacy, are you able to see the results or am I seeing it on my end only?
I am not, but if you could just give us a highlight of kind of how everyone responded, that would be great.
Of course. So I think the votes have slowed down. We have an answer of weekly 11%, monthly 33%, and the winner is C at 56%. I'm new to learning about how my health insurance benefits work, but I'm excited to learn more.
Well, awesome. That is exciting because now we can talk really about understanding about how our navigator process works and how it will support you in understanding more about how your health insurance benefits work, in particular when you are prescribed a Real Food Blends meal. So thank you, Tracy. Let's get back into the discussion. And thank you to everyone who participated in the poll. Now, as I mentioned, we will learn more about your journey through our Nutrition Navigator process. So I like to say that the Nutrition Navigator process can be broken down into 5 steps, okay? Let's spend a little bit of time talking about each of them now. So once you and your provider have decided that Nutricia Real Food Blends meal are the best option for you, your HCP will briefly inform you about the Nutrition Navigator program. The Nutrition Navigator patient information form is then completed in full by you as well as your healthcare provider, and is either faxed or emailed to begin the process. An acknowledgement will be sent to your healthcare provider, just letting them know that we've received their request to enroll you into the program. And then you will receive a welcome call from your case manager, welcoming you into the program and explaining what the next steps are for you in the journey. During this call, your Navigator case manager will screen to see if you might be eligible for WIC based on information that you will provide on your income and household size. And then they will see if you might need what we refer to as a bridge, but for you to understand, a bridge is a complementary, limited short-term supply of product so that you can begin your Real Food Blends meals immediately while we work through the insurance process and identifying a supplier for you. We're also performing quality checks along the way, ensuring that that patient information form is completed in its entirety. If information is missing, please know that your case manager will reach out to you as well as your provider to get that missing information. And if it is determined that you require a bridge, we will apply that bridge to your account at that time. Your assigned Navigator case manager will then conduct what we call a benefits investigation to verify the insurance coverage that you have for our product. If no coverage is available, we do explore alternate resources that you might be eligible for in order to help you gain access. You will then be contacted with the results of that benefit investigation's finding. And if a bridge was applied, we will confirm that you've received that shipment. We will also reach out to your healthcare provider and let them know the results of the benefits investigation, as well as let them know if any prior authorizations are required by your health insurance company. The Navigator case manager will then work to identify an in-network supplier that can service you as the patient. Once a supplier has been identified, you will be informed of who has received your referral and who will be servicing your case. Once that supplier has indicated that they have shipped the Real Food Blends meal to you, we will make a call to you to ensure that you are in receipt of that product. We will also provide information on how you can order refills from that supplier, and we will also provide this information to your healthcare team. And so there are a few things that we like to highlight, ensure that you have a successful start, right? One of those things is ensuring that every portion of the patient information form is completed with accurate information. We want to also ensure that we have your consent to partner with you to work on your behalf. So it is important that you sign that form, as well as ensuring that your healthcare provider does as well. Please note that we can receive separate forms, and so the form can be signed electronically or with a wet signature. And if you need to send in a separate form and your healthcare provider sends in a separate form, that is completely fine. We will marry those forms within our system once we receive them. And also, I wanted to highlight that once we are ready to send your referral to an in-network supplier to service your case, it's important, I feel like, that as a patient, you know some of the things that we request from your healthcare team. So it's important that they are providing us with letters of medical necessity, as well as a standalone prescription that is very detailed, including clinical notes supporting the need of Real Food Blends meals. One thing that I want to mention to you as a patient, just so that you can also share this information with your healthcare provider, is that we have developed an enteral order form that is available for your HCP to download online by visiting our Real Food Blends webpage that can support this process for them. And speaking about a prescription, these are details that your healthcare provider will ensure is available, but it's also important that you know the types of things that we want to ensure that that office provides for us to ensure that you receive your Real Food Blends meals as quickly as possible. We want to make sure that your HCP is specifying Real Food Blends meals by product name. We also want to make sure that they are indicating on that prescription, do not substitute. We want to ensure that they are indicating the daily amount noted, as well as your specific diagnosis codes and the number of refills that they are requesting for you. One other important thing to note here is that our Nutrition Navigator case manager and our team can also help with prescriptions that you have for your feeding as well as tube supplies too. So ensure, please mention that to your healthcare team and make sure that they are sending us all of your scripts.
Okay, quick pause for a knowledge check. I'm going to launch our next quick poll. So which of the following services can the Nutricia Navigator assist with for real food blends? A, insurance benefit investigation. B, locating a supplier. C, assistance with prior authorization. Or D, all of the above. Go ahead and submit your answers. So far, we have 100% with the D, all of the above.
Awesome. That's actually perfect because the Nutrition Navigator can assist with insurance benefit investigation, locating a supplier, as well as assistance with prior authorization. So perfect. Let's spend a few moments exploring how the Nutricia Navigator can assist with coverage options. So before we begin, let's keep in mind that these statements do not represent a guarantee of coverage and is only intended as a point of reference that can be further explored. All of this information is dependent on each patient's unique circumstances, their diagnosis, and their plan's policies. Now, as we all know, most insurance plans do cover real food blends meals under HCPCS code B4149. Let's start with WIC. So the WIC program does allow for real food blends meals to be covered under other nutritionals in specific states for patients who are deemed eligible to receive WIC benefits. Now, to date, Arizona, California, Nebraska, Pennsylvania, Texas, and Virginia all have real food blends on their WIC formulary. Now, thinking about Medicaid, right? So, Medicaid coverage for real food blends can vary depending on the state and specific circumstances. Now, in many cases, Medicaid will cover real food blends meals if it is deemed medically necessary and prescribed by a healthcare provider. Now, if it is covered, the following information will be required. They will need medical necessity determination. And so, what that means is that your healthcare provider will need to document all things related to your case specifically. They will need to identify alternate that maybe were tried and failed and why they feel like those options may not have been appropriate for your condition, as well as why real food blends is necessary. The Medicaid agency will also require that your healthcare provider write a prescription indicating real food blends by product name. And in many cases, a prior authorization will be required from the Medicaid agency in order for coverage of the blenderized enteral formula. This means that your healthcare team will need to provide additional documentation to Medicaid demonstrating, again, the medical necessity of the prescription, such as clinical notes. Currently, there are approximately 40 state Medicaid programs that have some level of coverage for HCPCS B4149. Now we can spend a few moments discussing Medicare. So Medicare may allow coverage for HCPCS 4149, and the coverage is based on several factors, right, including the specific Medicare plan, as well as medical necessity and whether enteral nutrition formula is prescribed by a healthcare provider. Here are some things to consider if you are a Medicare recipient. Medicare Part B typically covers durable medical equipment that is considered medically necessary for the treatment of an illness or an injury. Enteral nutrition, including real food blends, may be covered under Medicare Part B if it is prescribed by a doctor for a specific medical condition. Medicare does require that items and services be deemed medically necessary in order to be covered. This means that your healthcare provider will need to document why real food blends is necessary for your condition and how it will contribute to your overall treatment plan. Some Medicare Advantage plans and specific Medicare Part B plans may require prior authorization for coverage of real food blends. This means that your healthcare provider may need to submit additional documentation to Medicare to demonstrate medical necessity. And for those who are covered under commercial insurance, commercial health insurance plans, depending right on that plan, may cover HCPCS B4149 for blenderized enteral nutrition. But coverage can vary widely depending on your specific insurance plan and your medical need. Okay, it's important for me to highlight that commercial health insurance plans will often provide coverage for medically necessary enteral nutrition products, including real food blends, if it is prescribed by a healthcare provider. However, please keep in mind that coverage policies can differ between insurance companies and even between different plans offered by the same company. But the Nutrition Navigator team is able to explore that for you to let you know specifically what you have access to under your commercial plan. Now, similar to Medicare, commercial insurance plans typically require that items and services be deemed medically necessary to be covered. And so your provider, again, will need to document why real food blends is necessary for your condition and how it fits into your overall treatment plan. Some commercial insurance plans may require prior authorization for coverage of real food blends. And so, again, your healthcare provider will need to submit additional documentation, such as letters of medical necessity and clinical notes to your insurance company. The Nutrition Navigator case manager will walk you through this entire process, as well as work with your healthcare team to ensure that they understand what is required of them in order to work through the insurance prior authorization process as efficiently as possible. And so I know that was a lot of information. So let's spend just a moment kind of wrapping up what we discussed today. The Nutrition Navigator is here to help you. We would love to partner with you to provide you individual care while working through your insurance evaluation process and exploring all coverage options that you are entitled to. We will contact your insurance company on your behalf. We will perform a thorough examination of your health insurance coverage policies, and we will work with you hand by hand, working through the intricate landscapes of the insurance network. We will also explore all avenues to ensure that you are able to receive Real Food Blends meals as quickly as possible. I thought it might be helpful to share some testimonials that we have received from patients who have worked with our Nutrition Navigator program. So one says, "We appreciate you so much. We can truly feel how much you care for our patients and their families, and it means the world to us and to them." Another says, "It would be easy to forget the humans on the other side of all that you do, but be assured our little man drinks his formula every single morning and night. Thanks to people like you, you've made a huge difference in our home." And another, "Thank you for being such a relentless advocate for patients." Thank you all so much again for taking time out of your day to join us to learn more about Real Food Blends, as well as the Nutrition Navigator. We will pause there to see if there are any questions.
Thank you.
Tracy?
Yes, thank you, Stacy. Excellent. We do have some questions that came across during registration that I will share with you. And to everyone on the call, please feel free to use the Q&A feature and type in questions, and we will also get to those as time allows. So Stacy, we have questions that came in. One of the questions, near and dear to my heart, I also asked this as a dietitian: how can dietitians assist their tube-fed patients to obtain insurance approval for coverage using the Nutrition Navigator? So can clinicians do it, and how does that work?
Yeah, so definitely the referral can come from, any point of contact within that healthcare office. And so some things that can be done to ensure an efficient process we highlighted during the discussion today, but just to remind everyone, it would be important, again, just to have very detailed clinical notes to ensure that that provider is specifying Real Food Blends by name and ensuring that we're writing "do not substitute" on that prescription so that we can ensure that your patients receive their Real Food Blends meal of choice that they have been prescribed. It will also be important to ensure that we have accurate insurance information so that we are tapping into the correct benefit when we go to run those benefits to see what might be available for that patient. So those are some of the things that dietitians can do to help to support their patient's journey as well.
Perfect, thank you. And we do have a question in the Q&A that I'll read to you. So thank you for this question. Is there an age minimum for patients to use Real Food Blends? For example, my son will be 2 next month, but on pureed foods. Can he be a candidate for these meals?
I'm going to invite my colleague Victoria back into the discussion.
Hi, thanks so much, Tracy and Stacy. So Real Food Blends is appropriate for children and adults. We do suggest, over the age of 1, and as always, work with your healthcare professional when making any adjustments to your tube feeding routine.
Thank you, Victoria. And we have a question that is specific to another formula brand that we can answer those offline, because this is specific to mixing for somebody that's on another formula. So if it's okay, Lori, I will take your information and we can answer that question outside of the call, just because it's patient specific and brand specific. Thank you so much. And we have another that was submitted ahead of time, Stacy. We have patients and consumers from all over the world that register. And so somebody asked a question if you can help those in Canada.
Right, that's a great question, Tracy. Thank you for asking, or thank you to who submitted it. So while our Nutrition Navigator team supports patients who reside within the United States, our Real Food Blends team support all patients who are prescribed our meals. And so we can direct them with any support that we can offer to them. So if they have any specific questions, if they reach our Navigator team, our Navigator can definitely connect them to the Nutricia Real Food Blends team, and we can provide support there.
Thank you. And I think I know the answer to this question, but I'm going to shoot this one over to you and Victoria. Do all DME companies distribute Real Food Blends brand, or does it have to come specifically from your company?
So there are many DMEs who dispense Real Food Blends meals. Is working diligently every day to build additional partnerships with suppliers throughout the country to have more of them carry the Real Food Blends meals. The great thing is that if you contact our Nutrition Navigator, they can work to see where you are, where you're located, what insurance you may have, or what access you may have, and then we will connect you with a DME who would be able to provide you those meals within your coverage network. So you don't just have to purchase it from Nutricia.
Thank you, Stacy. And another great question that just came in right now from Linda. Linda works with oncology patients, and some patients feel very strongly that Real Food Blend should be covered, as they know the benefits of the blenderized diet and plant-based as well for those plant-based meals. And is that enough justification for a patient that has a diagnosis of cancer to get their tube feeding covered for Real Food Blends? Or does the patient have to fail an alternative formula for Real Food Blends coverage to be approved?
That is a great question. And what I will say is that we know that coverage policies relating to enteral nutrition or specialized nutrition are complex and they vary greatly, right? Depending on the coverage type that we're talking about and the payer, as well as the unique patient situation. And so, what I will say is that our Nutrition Navigator program will explore all available options that are available to each unique patient circumstance to see how we can assist them with getting coverage. And that's going to look different in every situation. But rest assured that our Navigator team will explore every option that is available if a patient decides that they would like to file an appeal on a coverage decision or request a peer-to-peer, we're here to support those. And so I think the best way to kind of navigate next steps in that specific situation is to refer that patient to the program so that we can explore their unique individual case.
Thank you, Stacy. This is very, very popular topic. We have another great question. So Linda asked, how would a clinician decide whether to transition a patient to Real Food Blends or a peptide formula when having GI intolerances not due to other known issues like medications or underlying medical conditions, because they seem like opposite considerations?
I'm going to invite my colleague Victoria back into the discussion.
Hi there, Tracy. Can you just repeat the question one more time?
Of course. So how would a clinician decide? So this is when somebody is not tolerating due to GI issues. And so how would a clinician decide between Real Food Blends or peptide when there's no underlying issues? It's not a medication, it's not a medical condition, just trying to determine which one and how would they determine?
Yeah, that's a great question. And of course, every patient situation is different. But the benefits of blenderized tube feeding is that it allows the patients access to, incorporate real food back into their tube feeding regimen, especially if someone was eating real food before the tube was placed. So maybe a patient, just has trouble swallowing, but they were tolerating real food perfectly fine beforehand. Or if a patient is on long-term tube feeding, do we really want a patient to go years or even months without ever having had a real fruit or a real vegetable. So blenderized tube feeding can help restore the feeling of normalcy and restore the mealtime approach to feeding versus conventional formulas. And some patients use blenderized tube feeding in conjunction with conventional formula. So it doesn't have to be an all or nothing approach. It can absolutely be tailored to meet each patient's, individual nutrition needs. So, some patients might choose to do, switch over entirely to blenderized tube feeding, and then others may use, conventional formula along with a blenderized product, just to get some benefits of, real food and variety rather than having the same monotonous formula every single day.
Thank you, Victoria. And now this question this may be for Stacy, it may be for you, Victoria. This is about approval during a hospital stay. So when we're talking about the insurance coverage with Nutrition Navigator, is this just for home use, or would it help during a hospital stay?
So it would be helpful to kind of get on the path of working with the navigator prior to the patient's discharge so that we can ensure that we have them on service when they return home. So, they can definitely, the hospital staff definitely will be directing their care while they are inpatient, but the healthcare provider can definitely initiate the start of the form to ensure that the patient can be on service once they are released.
Thank you, Stacy. And we have a couple more questions. One that came in earlier was, can I use the Nutrition Navigator services if I am uninsured?
Absolutely, yes.
That was an easy answer. And then, is Nutrition Navigator only for patients who are prescribed real food blends?
No. So while the Nutrition Navigator supports patients who are prescribed real food blends, our Navigator team supports patients who are prescribed any of the products that Nutricia support patients. So they can, providers can refer patients to our program for if they are prescribed any of our product family.
Perfect. And then this goes along with that when completing the form. If somebody is on real food blends and a conventional product, to Victoria's point, that it doesn't have to be all or nothing, how would the doctor complete the form?
So they would complete the form indicating the daily amount noted for the real food blends meals, and that is what we will work to seek if there are coverage options for them, and then that will be the amount that will be dispensed for the real food blends meals by the supplier. I hope that answered the question.
Yes, please enter in the chat if that did not answer your question. We also, I'm sorry, not the chat, the Q&A. Please type in the Q&A if that did not answer. I have another question here. Can somebody use the Nutrition Navigator more than once?
Absolutely. Yeah. So the great thing about the Nutrition Navigator program is that we want our patients to use it. We know how complex the healthcare environment is. And so we want to partner with patients who are prescribed real food blends meals. And sometimes that means that they have to use the program multiple times, right? Life happens, insurance coverage options change, family circumstances change. And so you can come back and use the Nutrition Navigator as many times as you would like. And the great thing is that our patient information form is valid for 12 months. And so you won't have to complete the form again. We may revisit and just, make sure that the prescription is still valid or if there needs to be any updates to the additional supporting documentation. But we welcome you to use the program as many times as needed.
Thank you, Stacy. And we had another that came in during registration. It's a comment, and I believe I know where they're going with the question. So the comment is, major medical issues have led to enteral feeding. We're slowly figuring out why he has issues with tube feed formulas. We did an at-home trial with real food blends, and he has significant improvements. Now insurance denials have started. So I'm thinking if someone's already using real food blends, then they're going through a denial. Can Nutrition Navigator help at that point?
What I would say is, from a general perspective, not speaking to this individual case, family specifically, because we don't have all of the details to support a complete answer, but the Nutrition Navigator can help even if a patient is already on real food blends meals. And so if you fill out the form, again, they will run all of the benefit information, look into everything related to that patient's specific diagnosis and treatment plan, and clinical notes, to see what are the options in terms of, what was the denial reason? Is an appeal appropriate? And just exploring more. So you can still utilize our services if you are currently taking the meals. So please start the process, and our team will be happy to explore options for assistance and additional support for you.
Thank you, Stacy. And we have another that came in. Is there a fee to use the Nutrition Navigator?
No, Tracy. So one of the great things about the Nutrition Navigator program is that you receive one-on-one support as often as you need it, and it is complimentary. And so Nutricia wants to be able to provide this service to support all of our patients through this process. So no fee.
Okay, and the last question I have here, unless anybody has any more to put in the Q&A, I have a question regarding, you answered about Canada. Is this also in every state in the US that someone can use Nutrition Navigator?
Yes, the Nutrition Navigator supports patients in every state within the United States.
Thank you so much. I think the questions have slowed down. If you wouldn't mind, Stacy, moving to the next slide, I'll keep my eye on the Q&A. Thank you so much. So thank you, Stacy, for sharing your time and expertise with us. This was incredibly helpful. I know I learned a lot. I did not know about Nutrition Navigator, admittedly, and now I will be able to advise others to check it out if they're looking for coverage, which I know is always a big question when someone's trying to move towards their, new tube feeds or moving towards blenderized. Coverage is always a top of mind. And the recording for everybody on the call is going to be on our website at oley.org/tube. That's where all Feeding Tube Awareness Week information can be found. Also at oley.org, you could see on the slide. And the recording will also be at oley.org/webinars. If you're not already, please follow the Oley Foundation on social media. We're on Facebook, Instagram, LinkedIn. And if you're not an Oley member, please join at oley.org, and you'll also get all of our email notifications about going on, just like everything for Feeding Tube Awareness Week. So we have a webinar coming up tomorrow at 1 p.m. Eastern, which is about anticipatory grief. It's a discussion for caregivers. And Thursday, we have a consumer connections video, so please check that out. And on our first slide, you may have seen a mention of our annual conference that's coming up in Charleston, South Carolina. That is June 17th through the 20th. That is a conference all for those living with tube feeding, with nutrition support, and their families. This is actually free to anyone living on nutrition support. So please check it out at oley.org. And for clinicians on the call, we have a discount, FTAW25, if you enter that when you register for our annual conference in June. Then you will get $25 off your registration. And we also have a regional conference coming up in Columbus, Ohio on March 22nd. And that is also free for all those living with feeding tubes and TPN and their families. So if you're in that area or nearby, please stop by and you can get more information oley.org. So thank you again to Real Food Blends for sponsoring Feeding Tube Awareness Week 2025. And thank you for this very, very informative webinar. I appreciate you all. Have a fantastic day and a terrific